health organizations are calling for a 100% tobacco tax increase. The group consists of the National Council Against Smoking, CANSA, the South African Medical Research Council and the Heart and Stroke Foundation South Africa. It's formed the hashtag Protect Our Next movement. For more on the story, I'm joined by National Council Against Smoking's Sharon Nyatsanza, who's live for us via Skype from Johannesburg. Sharon, thank you so much for joining us. Now, the numbers that your organization and your colleagues have put forward are quite striking. It's based on research done by the Research Unit on the Economics of Excisable Products, or also known as REAPS. And the numbers that they've brought up does make for some fascinating reading. In it, they point to the fact that South Africa collected 12.5 billion rand in tobacco tax in the last year, but that tobacco's harmful effects have cost the state more than 42 billion in healthcare costs and lost productivity. And you and your colleagues in this, behind this movement and this hashtag are saying that those numbers just don't add up, and that ordinary South Africans are actually bearing the brunt of the impact of tobacco on our citizenship. What do you have to say about why you feel it's fair to call for such a massive sin tax increase?
So, the current taxes on tobacco products are very low. And that is the main reason why we're calling for a 100% tax increase. So the current tax on a pack of 20 cigarettes is sitting at 17 rand 40 cents. But in the lockdown period, we saw, smokers being able to actually absorb prices as high as 114 rand to 300 rand per pack of 20 cigarettes. So this indicates that current taxes are still very low. And as you indicated, this is not commensurate to the tobacco harm on the country. The country is, the economic cost is 42 billion. And when you compare this to, 12.5 billion being collected in taxes, then you see that there is still a large deficit. And increasing taxes is one of the ways to actually close up this deficit.
What are you hearing from the health industry about the actual impact of tobacco? Of course, during that lockdown period where cigarettes were banned for a very, very long time, much longer than alcohol was banned for, a lot of smokers, of course, saying, listen, this is my choice. If I want to put my health at risk by smoking, that's my choice. But I suppose that's not necessarily how it works, because smoking tobacco has an impact on those who are near you while you're smoking. And you're saying, according to research, it's having a massive impact on the health system. What are you hearing from those in the health system about the very real impact of tobacco use?
So what we do hear from the health system is that tobacco is actually a common denominator for too many diseases. So if you look at the non-communicable diseases, like your heart disease, like your diabetes, like your cancer, tobacco actually is actually a risk factor for the onset of the four major NCDs that South Africa and the whole world actually struggles with. And even if you go to diseases like TB, you still see that tobacco is still linked to such diseases. So we were recently in the Breast Cancer Awareness Month. Again, using tobacco is actually associated with higher risk of developing breast cancer. So what we do see is that tobacco is becoming a common denominator to too many diseases. And this is not surprising, as the product itself actually damages almost all parts of the body as well.
Have you had any reaction from actual smokers to hashtag Protect Our Necks? Because we would have heard from them during lockdown when they could not legally buy tobacco products, but a lot of experience showing us there that people were willing to pay a lot of money for cigarettes or tobacco products off the illicit market, while others saying it actually gave them an excuse to try and quit smoking as well. Have you heard anything from users for your hashtag?
Yes, so we have had, from users as well. So part of, the campaign as well, as National Council Against Smoking, and we are also part of the campaign, and other organizations like the Cancer Association of South Africa, who are also part of the campaign, actually also, liaise like directly with smokers. And what we have seen from our part as the National Council Against Smoking is actually people stopping smoking during the lockdown. And one of the, the major reason for doing that has been the price increases. for that. Yes, we do have people who still believe that it is their right to smoke, like you actually did mention. But we also have a lot of people who actually also confess that it is because of the addictive nature of nicotine that they continue to smoke, not because they actually do want to continue smoking.
Just lastly, before I let you go, any word from government as to whether they would warm up to your suggestion of a 100% tax increase on tobacco products?
So we haven't had like a direct, indication from government on whether they will accept the call for 100% increase. But what we have seen is that the Treasury has rejected the pleas from the industry to actually freeze tax increases, and they've actually emphasized that the reason for increasing tax is actually to improve public health and to actually try and reduce tobacco consumption.
Okay, we're going to leave it there. Thank you so much. That's Sharon Nyatsanza, who joins us live via Skype there from Johannesburg, and she's with